Hello my dear student, I am Dr. Parvez Ahmad. Today I am going to talk about the drugs used in peptic ulcer. First you understand about the what is the peptic ulcer. Peptic ulcer means a sore that developed on the lining of esophagus or stomach or small intestine. Okay. Now different type of the drugs is available to use in a peptic ulcer. First you have understand about the what is the causes of peptic ulcer. Peptic ulcer basically occurs because imbalance between the defensive factors and aggressive factors. Defensive factors like bicarbonate, mucus, these are the defensive factors. Now aggressive factors are aggressive factors are NSAIDs, that is a painkiller, that is a non-steroidal anti-inflammatory drugs, corticosteroids, acid, pepsin, all are the examples of aggressive factors. Spicy food, also one of the example of alcohol, these all are the example of aggressive factors. Okay, so the imbalance between these two factors lead to the peptic ulcerations. Now the pharmacology, drugs used in peptic ulcer. First categories of the drug is called reduction of gastric acid secretion. Okay. In this category, first one is H2 blockers. H2 means histamine 2 blockers. We know that histamine, especially H2 receptor, is responsible for the gastric acid secretion. These are drugs which antagonize the action of gastric acid secretion. Examples are ranitidine. Ranitidine nowadays widely used at the dose of 150 mg to 300 mg twice in a day. Another example of this in this categories are famotidine, cimetidine, but cimetidine drugs is not used nowadays because it interfere with the reproductive system in male and female. That's why not use cimetidine nowadays. Now second category is of the drugs in this category, reduction of gastric acid secretion, is the most important, that is called proton pump inhibitors, that is called PPIs. Okay. Now examples of the PPIs are, first one omeprazole, second one pantoprazole, next one rabiprazole. Okay. The omeprazole nowadays widely used 20 to 40 milligram, pantoprazole also we have used 20 to 40 milligrams. Ramiprozole also we have used. And now these are drugs, especially pentaprozole, nowadays used along with the domperidone. We know that domperidone is a prokinetic drugs. Okay. And these categories of the drug, especially PPIs, is also called heat enhancing drugs. Okay. The single dose is sufficient to cover the 24 hours, and these categories of the drug, PPI generally we have prescribed in empty stomach. Now, next categories of the drug in reduction in gastric acid secretion is anticholinergics. We know that cholinergic receptor, muscarinic receptor, is also responsible for the secretion of gastric acid. That is why their antagonists, their blockers we have used to reduce the gastric acid secretion, that is called anticholinergics. Now, examples of anticholinergics are pyrangiepine, oxyphenonium, propanthelene. Okay. And these anticholinergics you can also call is a antispasmodic drugs. Okay. Now, next categories of the drug: prostaglandin analog, misoprostol. Example of this category is the misoprostol. Misoprostol is contraindicated in a pregnancy. Okay. So, these all are the examples of reduction of gastric acid secretion. Now, move to the another class. Second categories is called the drugs which neutralize the gastric acid. Neutralize the gastric acid. Now, in this category, two types of the drugs is nowadays available. First one is a systemic antacids. They are the clear from name antacid. What do I mean by antacid? Antacid means anta means counter the acid. That is the, these are the example of base. Basically, these are the basic in nature which neutralize the acid and form the salt. Now, example systemic antacid is sodium bicarbonate. In a market, sodium bicarbonate is the powder form is available. Eno powder is the most commonly used nowadays as a systemic antacid, but systemic antacid generally we have avoid because it causes alkalosis. Okay. Basically, this sodium bicarbonate react with hydrochloric acid, that is a gastric acid, and form salt, water and carbon dioxide. So, that means these are drugs act by the simple acid base reactions. Okay. Now, after the systemic antacid, second part is the non-systemic antacid. Non-systemic antacids. Okay. Now, examples are, and these categories of the drug nowadays widely used. Examples are aluminum hydroxide, calcium carbonate, magnesium hydroxide. These all are the examples of non-systemic antacid. Okay. Now, move to the next category after the antacids, that is next one is a third category is the ulcer protective. protective. Now, examples of the ulcer protectives are sucralfate, most commonly used drug, sucralfate. Mainly syrup is available of the sucralfate. Now, colloidal bismuth subcitrate, CBS also an example of ulcer protective. Now, next categories is the anti-H. pylori. We know that H. pylori is also responsible for the peptic ulcers. Okay. Now, here mostly antibacterial agent we have used to kill the H. pylori. Okay. Examples are tetracycline, clarithromycin, metronidazole, also effective against the H. pylori. Tinidazole also we use, and most important amoxicillin. These all are the example of anti-H. pylori drugs. Remaining parts we have will discuss in the next video. Thank you.